Hi, my name is Russ Knopp, and I'm the owner of Comfort Keepers and a proud supporter of the Hot Topics series. For the last 15 years, we have been keeping seniors safe and happy in their homes. I'd like to give a shout out right now to all the Comfort Keepers who are working around the clock to keep our clients safe and happy during this pandemic. We are proud to support the Hot Topics series in partnership with the Petoskey Chamber of Commerce. The Chamber has always been an awesome resource for us business owners. And during this pandemic, they've just stepped up their game even farther. Thank you, Petoskey Chamber of Commerce. We have Comfort Keepers. Hope you find today's presentation useful. As always, if you're in further need of assistance, please contact the Chamber. Thank you and enjoy the presentation.
Welcome to another Petoskey Strong Focus on Health. I am Nikki Devitt, president of the Petoskey Regional Chamber of Commerce, and I am joined once again by Dr. Karen DenBesten, the Infectious Disease Specialist for McLaren Northern Michigan. Thank you so much for joining me again, Dr. DenBesten. I appreciate it.
Hi, Nikki. Glad to be here. Thank you.
Time once again for us to kind of take a look at where things are. First and foremost, I want to check on how is McLaren doing right now. We have been surging at this point now for weeks. Last time we talked, we know staff is exhausted, beds are filling up fast, and, letting the community know where that's at. I know McLaren does a fabulous newsletter with updates as far as, inpatients, testing, and unfortunately releasing deaths too. So how have things been in the last week or so?
They've been busy. Our numbers keep, holding and if not increasing. On a respiratory isolation unit, we're running about 30 patients total in the respiratory isolation unit. We've opened up 2 units now. We have the 3rd floor as the respiratory isolation unit for the non-critical patients and the 2nd floor for the more critical patients. Maybe, a quarter of those patients are on ventilators. We have a good capacity still, and we have a good availability with beds. We have the personal protection equipment that we need, but the issue again is still staffing. Healthcare workers are still out sick and trying to recover and get better, so we can be here to take care of everybody. On any given day, we probably have anywhere between 40 and 50 healthcare workers that are out trying to get better so we can be back and take care of people. So that's the major issue, is staffing. But I can tell you we are working tirelessly, and I couldn't be more proud of our hospital staff here. The nurses are just phenomenal. The healthcare techs, everybody is just stepped up and risen to the challenge. We're here for the COVID needs and for any medical emergency. Don't delay care. We're here and we're able to take care of people, and we'll still be here taking care of patients no matter what.
And that's the important thing to get across too, is that it's any medical emergency it's important for people to understand. I think right now, especially as, I'm thinking of slip and falls when the ice starts and the snow starts, or if you're just not feeling the way you normally should, or some of those, very big warning signs that people would never ignore in a COVID situation and a health situation, that our hospital is still here to do those things as well. And don't think that your health does not matter. And, it's just COVID patients that are being seen right now.
Absolutely. I think back in the spring, a lot of people were delaying their care because of a full lockdown. And as a result, we saw people come in really quite ill, because they were delaying getting care for necessary medical needs. So we're here to take care of all those needs. And I will point out that we have really created a very safe environment in the hospital. Everybody's wearing their masks. Everybody's doing what they need to do to prevent the transmission of COVID. We're testing as many patients as we can on admission to prevent transmission.
And that's wonderful. We really appreciate, again, all the efforts that the hospital is putting forth right now to keep our community safe. And when you mentioned just now that, in lockdown state, people looked at things a lot differently, emphasizing the fact that right now we are not in a lockdown, we are in a pause. And the reason for this pause is obviously the, alarming number of positive cases, not just across the country, but in our state and our region. As people look to that next week is Thanksgiving, and the governor said it, we've said it, everybody keeps talking about it, that this is not a normal Thanksgiving, and this is not the holiday to gather in those groups, because that's when COVID is exchanged, and really social gatherings tend to be a great catalyst for it.
Yeah, small social gatherings without masks are where COVID is being spread right now. So even the CDC has put out guidelines for avoiding traveling during Thanksgiving. We just need to be really careful here. We're seeing a huge surge right now, and we're setting ourselves at a new baseline. And as people gather over Thanksgiving, a couple weeks after that, we'll see another huge surge, and then the deaths will follow a couple months after that. It's a predictable pattern that we're seeing as people get out and throw caution to the wind. We see the cases coming in a couple weeks after that, even to months after that, and the deaths follow. I'm very particularly concerned about Thanksgiving. College students, I know that the colleges are closed right now, but people come home, young people come home for Thanksgiving. They don't realize that they have COVID asymptomatically, and then they're transmitting it to their vulnerable family members. And that's just horrible if something like that happens. I think people really don't fully understand that this is no joke, COVID. I mean, it is a very serious illness with high mortality associated with it, and you can pick off grandma without even realizing it.
Yeah, and nobody wants to live with that. Nobody wants to know that after Thanksgiving you lose a relative, and that was your fault. Not fault, but your fault for not being more careful.
It can be prevented. Mm-hmm.
Yeah, nobody wants to have that on their conscience. So, the best way to prevent that situation in a family, no matter how much you need to see them, no matter how much you miss them, because trust me, we get how hard it is to be not around our families right now, is to just not do it this time around. There will be other Thanksgivings, there will be other holidays if you're smart with this one.
Yeah, two things I'd like to point out. First of all, you can asymptomatically pass on this COVID to people with or relatives that are higher risk for having bad outcomes with higher mortality. But also, people can get very sick with COVID and not recover too. You don't necessarily have to die or be asymptomatic transmitter. People can really get sick and have lingering symptoms for a long time from COVID. Young people in the hospital on oxygen, tired, fatigue, brain fog, not getting better. So it is a serious illness all around. So my plan is not to get COVID. And we're limiting our Thanksgiving. We're not having anybody. We're just the family that you live with is the ones that you should have Thanksgiving with. As a matter of fact, we've been asked, our CEO at the hospital has asked all healthcare workers not to travel, not to have get-togethers at Thanksgiving. That's the ask for all healthcare workers. That's what we're doing to keep our community safe. And I would ask everybody in our community to follow that as well.
Absolutely. And that's the Chamber's ask too. We want to keep our businesses open. We don't want a pause to be extended. We do not want further economic hardships for our businesses in our community. And we don't want to see more loss of life in our community. So, the ask is find a way to celebrate safely within the people that you live with. And, we've even got later this morning, I'm checking in with the college because they're actually going to do on Monday a little Zoom 101 for those who maybe aren't familiar enough with it, especially some of their typical lunch and learn, lifelong learning folks that would come in so that they can teach them how you can do something fun for Thanksgiving and interact with your family. So kind of some tips and tricks. So we're, it's little things like that I think will matter. I mean, my family, we've already set up our 7:00 Zoom meeting on Thanksgiving with everybody all across the country. And so you can do that and it'll be good. It's more than nothing. So it's better than sitting back and complaining or being angry. Just be proactive to stay safe and make the best of the situation.
There's so many things we can do to stay safe and show kindness to others. I know my family is doing a drive-by Thanksgiving, make your food and then drive it by the relative's house and drop it off and pick up. You can do that with family, even with people that aren't family, friends, strangers. There's so many ways that you can show acts of kindness without, and to share without spreading this virus.
Absolutely. And that should be that should be on everybody's agenda for Thanksgiving. Find a way to make somebody else smile in a safe way. Do it right. Come up with an idea. There's all kinds of things, as you just pointed out, that we can do for each other. Another thing I wanted to catch with you as we update again this week, is that there's a lot of excitement. 2 vaccines now, raring to go. One of the things that we've been talking about in planning for 2021 is be patient with that. Don't think that just as these move forward in the coming weeks and months, remember that, by the time we get them distributed to the general public, and it's going to be a little bit. So while it's fantastic news, it's also not a reason to let our guards down more or fall deeper into that COVID fatigue of not wearing masks and not being distant and using good hand sanitization. So.
Yeah, there are 2 vaccines that are in FDA approval right now, the Pfizer vaccine and the Moderna vaccine. Both, I'm sure everybody's read in the news, have been shown with preliminary data to have excellent efficacy, like 95% efficacy to prevent COVID for each vaccination. So that's awesome. I haven't seen the safety data. Both of these vaccines are what we call messenger RNA vaccines. So they're kind of a new technique, very exciting. And they've gone to FDA for fast track approval. The fast track approval doesn't mean that the due diligence won't be done. It's just they're speeding up the process with the data the review process. So hopefully those will be available in the coming weeks to months. One of the problems with the Pfizer vaccine, though, as I mentioned with our last talk, is that it has to be kept at like -70 Celsius. So that's going to be a hard distribution right there. You're going to have special freezers to distribute it. So I don't think you can't go just to your doctor's office. They won't have the capacity to, give the vaccine there. So I'm not sure how the distribution is going to be rolled out, but this is going to have to require a lot of planning and special measures to get it delivered in an effective fashion.
Now the Moderna, the other one though, to my knowledge, does not have
I'm
to
not
be
sure about the one on that, but
I think that one is not going to need to be at the same, as they're obviously moving forward with these in, hopefully, like you said, distribution is, it's wonderful to have one, but you need to be able to distribute it to everybody too. So.
Right. And then I would assume that they would, get people vaccinated that are higher risk first, or frontline workers, vaccinated first. But even if, when the vaccine is rolled out, COVID is still going to be out there in the community and being transmitted. Mm-hmm. So it's not going to negate the need to wear masks and to be safe for the foreseeable future until we have enough people immunized to stop the spread of COVID. So this is going to be, masks are going to be with us for probably 2021 as well.
Right. And knowing that now and accepting that is going to be a big step, I think, for everyone. Just accepting the fact that a mask is what it is, and we're going to keep wearing it because it's going to keep our community safe. It's going to keep our businesses open. It's going to keep our kids in school. That's vitally important to keep them in person as much as possible. Our high schoolers right now in Michigan are on a little extended online learning, and it's hard for them. It really
hard on everybody. Yeah,
and it's hard on parents. And the last thing we need this winter is to have all students back online, and because parents are going to be really taxed with that. So it's thinking forward, thinking ahead, and remembering that the simplest thing you can do is put on a mask and just be smart about what you're doing, where you're going, and be kind to everyone. They need it right now more than anything. Just random strangers. They can see your smile under your mask they can see it in your eyes.
Yeah, I think, words really matter too. I know that a lot of the healthcare workers are seeing things posted on social media that are flat out wrong and false. And that's really demoralizing, to healthcare workers when they see that. It questions, what we're doing out here when you see stuff like that. So people need to reach out and be kind to each other and understand that everybody's really going through a hard time right now, and everybody's doing the best they can to take care of everybody.
And respecting our healthcare workers right now shouldn't even be a question. Yeah, it shouldn't even be a question. So on behalf of all of us who do respect, admire, and are so grateful for all you do, thank you to all of the healthcare workers and all of our frontline right now. We know, and we know we would be in a much worse situation than we are if we didn't have the passion and dedication behind our hospital.
Yeah, absolutely. And kudos to the nurses and the medical assistants and the healthcare workers in the isolation units right now. They're and everywhere. They're just doing an awesome job, tirelessly awesome job.
every day. And they don't, it doesn't stop. COVID doesn't go away after 5 o'clock. It doesn't go away on the weekends.
24/7.
It's 24/7, and it has been for a long time, and it will be. So we thank you and we appreciate you. I hope everybody is safe for Thanksgiving, and let's look at the next time we catch up. Hopefully we hear some good things as far as, no, I didn't go anywhere for Thanksgiving. No, I didn't go anywhere for Thanksgiving. Right. That'll be a great time to celebrate and go forward with that. But thank you for taking time, Dr. DenBesten, as always. And we appreciate it, and stay safe and keep doing what you're doing. And we appreciate you so much.
Thank you. And be kind and be smart.
Always the best words to end with. Be kind and be smart.